Hello everyone, my name is Sam. I'm a GP. It's me again. Today I'm going to give a talk on a topic called lower abdominal pain. Lower abdominal pain is a very common presentation to general practice. It is also a very common presentation to the emergency department. So, any medical student or medical practitioner should familiarize themselves with a list of common causes of lower abdominal pain. Before I go on, I want to take this opportunity to do a revision on the principles of history taking again. So to take a good history, one must be able to know the general anatomy of the human body very well. Number two, one must be able to identify the primary organ at the location of the symptoms. Number three, one must be able to identify the surrounding and or related organs. And number four, one must be able to think about the pathological process that can affect the organ. The mnemonic that I use is again into med DDD. And number five, to be able to use key history features and the age group of the patient to identify the most likely cause of the presenting complaint. Again, this is a mnemonic that I use and what they present. I for infection or inflammation, N for neoplastic, T for traumatic, O for obstructive or compressive, M for medication or drug, E for endocrine or thyroid or diabetes, D for depression, and the remaining 4 Ds are deficiency, degenerative, dysfunction, and developmental. Before we move on to the causes, let's also take a look at the anatomy of the lower abdomen. So we can see here that the large intestine has got different segments that has got different names. The appendix is at the beginning of the large intestine. Okay, and the next segment is the ascending colon, followed by the transverse colon, which is then followed by the descending colon. And then the name changes to the sigmoid colon, and finally end up in the rectum before stool is passed out from the body through the anus. Here, the small intestine is located centrally in the abdominal cavity. It is made up of 3 parts: the duodenum, the jejunum, and the ileum. Next, within the lower abdominal cavity, we also have got the female reproductive organ. As you can see here, we've got the female reproductive organ. The 2 fallopian tubes are represented by the yellow arrows, and then the green arrows points to the ovaries, and then the uterus is represented by the longer red arrow, and finally the cervix is represented by the shorter red arrow. Next, we have got the male reproductive organ system. We've got the bladder, the prostate, and the testicles. Obviously, the penis is being shown there as well. So, here is a list of all the common causes of the lower abdominal pain. First, we will start with the small intestine. So, common pathological process that can affect the small intestine include obviously inflammation. I didn't put it here, but inflammation of the small intestine can cause pain. Small bowel cancer, although very rare, can cause pain as well. Any perforation in the small intestine can also cause abdominal pain. And obstructive process in the small intestine include gas, pain, small bowel obstruction, and hernia, especially strangulated hernia. Next is the large bowel. Generally speaking, appendicitis causes lower abdominal pain, which started in the periumbilical area and then slowly moved to the right lower abdominal region known as the right iliac fossa. Diverticulitis usually present with lower abdominal pain in the left lower quadrant, and colitis, depending on where it is, can present with pain in different parts of the lower abdomen. Other rarer causes include peritonitis and intra-abdominal abscess. Obviously, large bowel cancer, if they grow big enough, can cause dull lower abdominal pain, which persists throughout the night. More common causes of large bowel obstruction include fecal infection, which can present as abdominal pain, and in rarer cases, sigmoid volvulus, which is a twisting of the large bowel, can also cause severe excruciating abdominal pain. And obviously, in the majority of the population, irritable bowel syndrome can also present with chronic recurrent abdominal pain. Other than the small and large intestine, we also have to think about the vasculature within the abdominal cavity. In the larger population group who has got a history of coronary or atherosclerotic disease, we have to think about a rupturing abdominal aortic aneurysm or dissecting aneurysm as the cause of abdominal pain. And in a smoking population who also has got a history of atherosclerotic disease, we also have to think about mesenteric artery occlusion as a cause of abdominal pain, which can be worsened when a person smokes. After looking at these intestine causes and the vascular causes, it is important to know whether your patient is a man and a woman, obviously. If it is a woman, we have to think about the female reproductive organ. Infective processes that can affect the female reproductive organs include urinary tract infection, sexually transmitted infection, acute infection and inflammation of the fallopian tube called acute salpingitis, recurrent pelvic inflammatory disease, which is an STI-induced inflammation of the female reproductive organs, period pain, and endometriosis. In older population group, we have to think about ovarian tumors as a cause of abdominal pain as well. And obviously, in younger population group, ectopic pregnancy also commonly present with acute abdominal pain. Next, we move on to the male reproductive organ system. So, lower abdominal pain in men, we have to also consider urinary tract infection, STI, prostatitis, and orchitis as a differential diagnosis. Again, this is what I need to remind the reader about. We only see what we actively look for. We only look for what we know, and therefore, we cannot see what we don't know. So it is very important that we know the general anatomy within the human body so that we know what organs may be responsible for the symptoms that the patients are presenting with. Again, the principles of good history taking are 1. Know your general anatomy. 2. Identify the primary organ at the location of the symptoms. 3. Identify the surrounding related organs. 4. Think about the pathological process that can affect the organ. The mnemonic is intimate DDD. And 5. Use the key history features to identify the most likely cause of the presenting complaint. Thank you for your attention, and thank you for taking time to watch this video. If you like my video, please kindly subscribe and share with your friends. Again, this is my disclaimer. Thank you very much.